matter if my face disappears off the screen. So good afternoon, everybody. Welcome to this meeting of the Dudley Health and Wellbeing Board. The meeting is being held virtually by Microsoft Teams and is being held live via the internet. It's a formal board meeting, and it will assist the conduct of business if participants speak only when invited by the chair. This meeting is being recorded via Teams. All participants should mute their microphones and video feed when they are not speaking. I reserve the right to adjourn the meeting as necessary if there is any disruption or technical issues. Please remember to unmute your microphone and video feed when it is your turn to speak. Please speak clearly and slowly into the microphone. Members of the public can view proceedings by clicking on the link that has been provided on the agenda. So, Lisa, do we have apologies for absence?
I don't have any apologies from elected members, but I think there may be some substitutes for some of the other members, but Chair.
Okay, thank you. Thank you, Lisa. We'll deal with those as they come if they need to speak. I'm aware that Matt Boucher and Karen Wright are joining the meeting in due course. They are on other meetings at this moment, and Andy Gray should be joining us shortly as well. I think Professor Kingston has joined the meeting because I believe that he wasn't able to join us earlier, but I think he has entered the room. So good afternoon, Professor Kingston, if you're with us. Can I also take this opportunity to welcome Catherine Driscoll, our new Director of Children and Young People for Dudley Council. So Catherine, I think this is your first formal Health and Wellbeing Board meeting.
It is indeed. Thank you. Really pleased to be here.
We're very pleased to welcome you as well, Catherine. So thank you very much for joining us. Right. Before I move on with the proceedings, we have a couple of additional items that were sent out to members yesterday. These will be discussed at the end of formal business, so after agenda item 13 in an informal session of the Health and Wellbeing Board meeting, and therefore will not be contents will not be recorded and will not be minuted as well. Okay, so moving back on to the formal agenda. Item 2 we've dealt with in terms of substitute members. And item 3 to receive any declarations of interest under the Members' Code of Conduct. I take it we've got none to declare, Lisa.
Thank you. Can I just say, I'm not sure if it's just me, but I'm having difficulty hearing you on occasions. Your mic seems to be cutting in and out, Chair.
Right. Is anybody else having difficulty hearing me?
On occasion, it's okay at the moment.
Right. Okay. I will. I think it might be my microphone. I'll try and hold on to it. So I'll keep going. Okay. Right. Item 4, to confirm and sign the minutes of the meeting on 3rd of December as a correct record. Are members happy for me to virtually sign those off?
Yes.
Thank you very much, Councillor Ridney.
It's all right.
Okay. Right. Moving on to item 5, and that's an assessment of the impact of COVID-19 on Dudley's health and wellbeing. And Susie, I believe that you are presenting this, or is it Karen?
No, it's going to be Susie. I was just coming online as well.
Okay.
Okay, so Susie, do you want to?
Yeah, I'll just get my slides up. I won't be a second. Can everyone see those?
Yes, thanks.
Perfect. Lovely. Thank you very much. So I'm Susie McFall. I'm a public health registrar working at the council. I've been carrying out a needs assessment to determine the local impact of COVID on Dudley's health and wellbeing. At the December board meeting, I presented the findings from my interim report. So this is a refreshed presentation, including the new key findings. So COVID has clearly produced widespread impacts. As well as the direct impact of COVID infection on mortality and morbidity, there have been many indirect impacts which have arisen from the social distancing measures. Indirect consequences can be summarised into 6 broad impacts. So those that have arisen due to the postponement of NHS activity and economic, social, mental health, health behaviour and environmental impacts. And the burden of these impacts has not been felt equally across society. Those groups that were most disadvantaged before the pandemic have had a double impact, suffering a relatively high number of COVID deaths and infections, as well as being the hardest hit in terms of the wider determinants of health. So firstly, the direct impacts. There has sadly been substantial excess mortality in Dudley since the pandemic began, especially between mid-March and early May, and then again since November, which can be seen by the spikes in deaths in this graph, which shows the weekly number of deaths in Dudley alongside the 5-year average, which is shown by the green dots, and the COVID deaths are shown in orange. The total number of COVID-related deaths in Dudley up to the 19th of February is 790. And by mid-January, there were approximately 1,380 COVID discharges from the Dudley Group Hospital, and it is estimated that 45% of those discharged require aftercare. The current estimate is that 10% of all COVID cases will suffer from long COVID and experience prolonged symptoms for more than 12 weeks. And some of these individuals will require support from healthcare services and also community support. The rates of infection have not been equal across the borough, with a disproportionate number of COVID cases in some groups. Between March and November, 19% of all infections in Dudley where ethnicity had been recorded were in BAME individuals, which is higher than the proportion of Dudley's population that is from a BAME group, which is 12.8%. And as can be seen from this map, there have been substantial variations in the overall infection rate by ward, with a general picture of the most socioeconomically deprived wards seeing the highest infection rates, in particular those in Dudley Central. And it is therefore likely that the need for post-COVID healthcare will be distributed in a similar way. So moving on to indirect impacts, and starting with those that have arisen due to the postponement of routine NHS activity and a decrease in the number of people accessing healthcare due to a fear of becoming infected with COVID and a desire to protect the NHS. The decline in the number of people seeking emergency healthcare was seen with a sharp drop in the number of A&E attendances to the Dudley Group at the start of the pandemic. Attendances increased after this, but in December was still 31% lower compared to December 2019. And some patients will be self-managing, but there may also be an unmet need for emergency treatment. And there's been a 4.3% increase in the proportion of deaths occurring at home in Dudley in 2020, which raises concerns over people not accessing hospital care for time-sensitive conditions. And there's also evidence that individuals have avoided presenting to their GP, and this will have contributed to the steep drop in the number of routine referrals at the start of the pandemic. Routine referrals haven't really fully bounced back, and by the end of November were still only 69% of baseline. Fewer presentations and referrals mean fewer opportunities to diagnose disease. An example of this is a 4.3% reduction in the number of individuals who've been given a dementia diagnosis as a proportion of the estimated number who have dementia in Dudley. And quite clearly, individuals with undiagnosed disease cannot benefit from support services and treatments. There's a well-established link between income and variations in health, and unemployment has consistently been found to have a negative effect on both physical and mental health. In terms of the economic impacts, an estimated 16% of jobs in Dudley are within sectors that have had to come to a complete halt at some point during the pandemic. And we know that younger workers and those from a lower socioeconomic group are most likely to be working in these sectors and therefore had their income stopped or reduced. And the graph here shows that in April and May 2020, there was a sharp increase in the number of Dudley residents claiming unemployment-related benefits. Currently, 7.3% of the local working age population are claiming, higher than the 6.3% claiming nationally. And the furlough scheme is likely to be masking the full effect of COVID on unemployment. The number of residents on the furlough scheme has varied throughout the pandemic, but at the end of January, 20,000 eligible residents were furloughed. And meanwhile, the impact on food insecurity can be seen with a 24% increase in the number of meals issued by the Black Country Food Bank in 2020 compared with 2019. And this figure is unlikely to capture the full need for food banks due to the government food boxes and the pop-up food banks that have emerged. In terms of social impacts, the increasing reliance on digital health information and social contact via online platforms exacerbates the effects of digital exclusion. And currently, an estimated 11% of individuals in the West Midlands are completely offline. It was found that during the school closures of 2020, children from the most deprived households were the least likely to have access to online teaching. Before the pandemic, there were variations in educational attainment by ward, and the school closures therefore risk widening this attainment gap further. Since June 2020, the number of homeless applications received by the council increased above those received in the same month of 2019. And this is despite the extension of the minimum notice period to 6 months. Soft intelligence suggests that this recent increase in applications is not due to movement in the private rented sector, but rather a result of relationship breakdowns, domestic violence, and intergenerational families no longer able to live together due to conflicting attitudes about COVID risk. And finally, there's been a consistently higher number of domestic violence incidents recorded by the police in Dudley since April 2020 compared with 2019. In terms of mental health impacts, 45% of residents who responded to a local survey called the Behaviours survey reported a deterioration in their mental health since the start of the pandemic, and 43% said that they were lonelier. National research has found that loneliness in the wider shielding and isolating community actually deepened during the easing of restrictions in the summer, as they found that they were unable to take advantage and felt as though that they were missing out. A recent national survey has found an increase in the proportion of children with probable mental health problems compared with 2017. Children reporting a mental health problem were more than twice as likely to be from families who had fallen behind on payments. A study in the West Midlands investigating the mental health of frontline healthcare workers during the pandemic found that almost a third reported clinically significant anxiety and depression, and almost a quarter reported symptoms of post-traumatic stress disorder. However, only 15% were accessing psychological support. And moving on to the impact on health behaviours, there's some evidence from regional surveys that the number of people self-reporting as a smoker may have declined since the start of the pandemic. In keeping with this, the proportion of pregnant women who are recorded as a smoker at the time of delivery has been decreasing in Dudley for some time. This decline has continued during COVID and is currently 7.7%. Evidence from active Black Country found that 76% of previously inactive people increased their physical activity at the start of the pandemic. However, whether these new adopters have sustained this behaviour is currently unclear. And there were 149 fewer people completing the 12-week Let's Get Healthy Dudley weight management course in April to September 2020 compared to the same period of 2019. And we know there's a social gradient with overweight and obesity, with those who are the most deprived being most likely to be overweight. So missed prevention opportunities, such as those offered by the Let's Get service, therefore do risk widening health inequalities further. However, there's some early evidence that the new virtual weight management service increased the proportion of completers who met the target of a 5% loss of body weight. So finally, environmental impacts. Air pollution is the biggest environmental threat to health in the UK, and road traffic dropped to 30% of normal levels in the West Midlands in April 2020. As can be seen from this graph showing the nitrogen oxide levels at a monitoring station in Albury, so just outside Dudley, there was a significant decrease in nitrogen oxide levels during the first lockdown, shown in blue, compared to the previous year's average, which is shown in red. So finally, recommendations and future considerations. Understanding the local impacts will help to inform the reset of the Health and Wellbeing Board's strategic purpose during the recovery phase. With so many far-reaching impacts, it is clear that partnership working will be important and a focus on health inequalities is also needed. There will likely be increased demand on services during the recovery phase, which will come from an increase in the prevalence of mental health problems, exacerbated chronic diseases, and individuals who need post-COVID healthcare. And there is still a need for effective messaging that encourages people who need healthcare to access it, despite ongoing infection prevention precautions. Overweight and obesity and unhealthy behaviours such as smoking continue to be leading causes of preventable death. It is therefore vital to continue prevention activity wherever possible. It would be useful to identify individuals who are at high risk of digital exclusion locally, and over the coming years increase capacity to support digital literacy. And contrary to what might be expected, the need for loneliness support may actually increase for certain groups during the easing of restrictions. And there's also an unmet need for mental health support for frontline healthcare workers. And finally, the evidence presented relating to air quality improvements during the lockdown can be used to support a shift to active forms of travel. Thank you very much for listening. And are there any questions?
Fran, that's absolutely wonderful. Thank you very much, Susie. That's a very good meeting response as we move forward. I think messaging is incredibly key. To get people going back to their GPs rather than treat a problem themselves or not deal with it. Absolutely vital. And also the same with visiting hospital as well. If they get their outpatient appointment, that they absolutely go there, and I'm sure that there is that fear of going into a hospital setting where they think that it's full of COVID, which is absolutely which we know isn't the case. So I think we all need to do our bit to get those messages out there. I think around the preventative work and prevention has always been my thing, really. We've got to continue again with the preventative measures that we can continue to do that. And this report sits rightly within the health and wellbeing agenda around loneliness and isolation. It's a huge thing at the moment, and you're right to highlight the fact that the mental health of all our frontline workers is going to be sorely tested, and I'm sure it's been sorely tested over the last 12 months, especially those dealing with people fighting for their life with COVID, and sadly seeing people losing their life. So a very thorough report. And also you touched on the air quality, and I know that's been an issue in a number of our wards across the borough, around Netherton especially. So yes, I think it'll be certainly interesting to see those reports over the next few months about the impact that it has, and I'm sure it has undoubtedly improved that. And so again, we need to look at what we can do, with our transport providers about cleansing, which I know is quite an important thing that they're moving forward. So thank you for that. I've got 3 hands raised so far. I've got Karen Wright, then Councillor Ridney, and then Chris Reno.
Thank you, Councillor, and thank you, Susie, and well done, a cracking piece of work. And I think the Health and Wellbeing Board should be commended in actually commissioning this piece of work. I think that's really important, and I think it's the start of a journey. So that the draft report's already been to the Forging Futures executive and to other partners, and we will be building on this as a council, bringing in other economic and other data to inform what we need to do, and likewise actually developing really robust both strengths-based, looking at what is there that we can build on, but also understanding what are the new challenges and growing challenges within different parts of the borough, so that we can have quite localised approaches to responding to some of the issues that are there. So the other thing for me, it's the start of a journey. We're definitely going to be adding more information to understand inequalities. The second thing is just to say that we as a system are producing our local outbreak management plan and how we're going to be living with COVID moving forward. And all of this information is really important to inform what we do and how we invest any resource, and really understand what those needs are moving forward, from job opportunities right through the whole piece. And obviously the health and wellbeing strategy, which I think does continue to have the right priorities, actually will be very much part of that work moving forwards. Thank you.
Thank you, Karen. Councillor Ridney.
Thank you. A very good report, although I have to say none of the information in it surprises me really. For those of us that are out there in the community, we can tell you how bad it is. We don't need a report like this. We can see the number of families that are struggling after this, and even and with mental health. As you know, I chair Christchurch School in Cosley, and we have been dealing this week with a real issue. A child from a vulnerable family was in school all through the lockdowns, has not been because he was a vulnerable family, but now we are dealing with real issues because the other children are back in. He can't cope with that. He's got real issues in his own as a vulnerable family. His carer is his grandfather, who is now ill. These are the issues that we are dealing with, and I'm sure Councillor Barlow has the same, because I'm not saying this is just in deprived areas. It isn't. Families have been hit very hard, and that's not even including all the economic situation that they are faced with, but the number of people that are having to be helped with food parcels and to be fed. And at Christmas, something in Cosley we've never had to do was to hand out parcels for Christmas and toys for children. That just says how bad it is. And I honestly believe, from listening to my own members of my own community, this isn't going to get better very quickly. And I do think that the focus, and certainly for children, needs to be started now. I think we have much more damage to be seen. On the health point of view, I think a lot of people have been coping at home, self-medicating, doing what they can. I mean, I suffer from COPD. I had an assessment over the phone. That really does give me great confidence that they know exactly what my condition is. They could probably tell by the wheezes down the phone, but nevertheless, that's how you're assessed. I can't believe that we're even doing this to people. I really can't. And of course, the pollution levels, yes, much better. I did say to the chief executive only a couple of months ago. He asked me how I was, and I said, "Well, I've been great because I live on a main road, less traffic, even been able to have the windows open." It has been a real difference, but obviously things are getting back to normal, and that will change again. So I think what COVID has done, if not, besides the number of deaths and the illnesses, what it has done is highlighted some of those problems that we've had within our communities for a long time, and we've actually not focused on them. We've coped with them, we've chugged along with it, but now there is now is the time to actually address some of these issues. I don't want to go through the list again, but like I say, very nice report. Thank you very much, but it hasn't told me anything I didn't already know from just going out there and talking with and being in my own community and seeing it every day.
Thanks, Councillor Ridney. You're absolutely right. I think it's when you hear of these cases local to close to home that it does hit you. I heard of a case only the other day of an 8-year-old that is self-harming because she's back at school. So it's quite harrowing when you hear these. Chris, you've got your hand raised.
Yeah. So, Suzanne, I'd like to congratulate you on an excellent report as well. I think it's really fabulous what you've done. It actually fascinates me how much information you managed to pull out, even in a year where people have been working from home and trying to pull all this stuff together under quite difficult circumstances. I do agree with Councillor Ridney in that there's not a huge amount in there which should surprise anybody. Having said that, you've pulled it all together into a really coherent document and pulled it in with some of that harder evidence, and I think there'd be huge value in you actually going around some of the other organisations in Dudley. There's organisations like Dudley Integrated Health and Care, Black Country Healthcare, Dudley Group Foundation Trust, and actually presenting this to their boards directly, so that yes, they've got a feel of what's going on, but actually presenting them some of the hard numbers, facts, will also help them think, okay, this is where we need to concentrate our efforts in the future. So congratulations on a really excellent report. Thank you.
Thank you very much.
Thank you, Chris. No, I think that's a good approach. So the recommendations, I think, that we continue to deal with what is facing us at the moment, and that report really hits home the impact that COVID is having on everybody up and down this country. So we'll continue to work on that. We'll certainly continue to look at the air quality that Councillor Ridney has mentioned as well, and how we can continue to work with our officers right across the council to address that moving forward. So again, thank you very much for that detailed report. I think I would be extremely shocked if anybody said that had been a surprise to them. So Sue, I do appreciate the fact that it is no surprise. So that is one good thing, but it does hammer home how serious this has all been. So moving on now to item 6, and that's Neil with a vaccination programme update.
Chair. So I'll just talk a little bit about the report that you've got in front of you, and then I'll just sort of update you in terms of a couple of things that have happened since the report was written, and what's been on the news over the past 24 hours or so. So I was reminded today that the vaccination programme has actually been going for 100 days now, so we're well into it. In the report, I've identified the 9 sites from which the programme's been run in Dudley. There's actually a 10th site now, because we also have a vaccination centre at the Priory Pharmacy on the Priory estate. So 10 sites in operation. The general message is that we're making very good progress, both in terms of the speed at which the vaccine is being rolled out, and the amount of coverage and uptake that we're getting across the priority groups. I've indicated there what the position was when I wrote this report about 10 days or so ago. As of this morning, we've still got a coverage rate that's well in excess of 90%. So in terms of the 80+ population, 95% coverage. The 75 to 79s, 96%, the 70 to 74s, 95%, 65 to 69s, 91%, and the group that the focus has been on in relatively recent times, so that's the over 60s, the 60 to 64, that's about 85%. In addition, we've got good coverage as well in terms of the work that we've done in our care homes, both in terms of the care home residents themselves and care home staff. That's well in excess of 70%, and I think that's an indication of the valuable sort of partnership work that we've done on the programme with colleagues both from general practice, from the CCG, from Dudley Integrated Health and Care Trust, from Public Health, and from Dudley Group Foundation Trust, who work together in terms of trying to ensure that that bit is completed effectively. What we do know is that take up isn't even across the population. Take up is lower in those areas that display more socially deprived characteristics, and also in the part of the population that where there's high degrees of Black and minority ethnic population. So that's something that we've been looking at in conjunction with council colleagues and also partners from the voluntary sector, and we've done some specific work over the past few weeks to try and encourage take up from those people who've previously refused the vaccine. So, for example, we've done some work with Tandrusty, a voluntary sector organisation that promotes the health and well-being of people from a Black and minority ethnic background. That appears to have been successful in terms of encouraging people to have a vaccination who previously turned down the opportunity to have the vaccination. We're now doing some work where Tandrusty are providing some training for our practice staff in terms of how they have conversations with people about the vaccination programme, and we're also involving our health coaches in that work as well, and that seems to be giving positive benefits. We've run a couple of pop-up clinics in particular locations, and yesterday we ran one in Lye which seemed to work well, and we're going to review that and see how we can extend that model again to encourage further take up. So generally speaking, with the programme is progressing well. We know those areas that we need to focus on, and we're starting to address that, you know, in conjunction with our council partners, our voluntary sector partners. As you may well have heard the news that over the past 24 hours or so about vaccine availability. So a couple of points that I made in this report when I first wrote it are no longer correct. I did quote the Secretary of State as saying that the vaccine supply is lumpy, and I think that still is correct. He said, I think he used those words yesterday as well, but two main changes to make you aware of. The first is that in the report, paragraph 6.1, I said that it was likely that primary care wouldn't be involved in the delivery of the programme beyond what we refer to as cohort 9. That's no longer the case. General practice has been invited to express an interest in being involved in an extended programme that goes beyond the immediate cohorts. They've got a deadline of this weekend to express an interest in doing that. They can only do so if they can demonstrate that they're able to restore traditional primary care at the same time. But we're awaiting indications from practices as to whether or not they want to do that. The second issue that we've got is that there's going to be some difficulty in terms of vaccine availability during the month of April. That was announced yesterday evening. I've been involved in at least 3 meetings during the course of the day about that and what the implications might be. So we're still working through that, but we do know that the vaccine that's required for delivering the second doses will be maintained during the month of April. And as somebody's just put up on the chat, I had an alert on my phone not so long ago where the EMA have said that as far as the AstraZeneca vaccine is concerned, it's regarded as safe and effective, and the benefits of that vaccine outweigh the risks. So hopefully any concerns that people may have had in terms of coming forward for their vaccination because of reports about AstraZeneca and blood clots and so on, hopefully that will help deal with that issue. So that's where we're at the moment, Chair. Progressing very well. We know the areas that we need to focus on in terms of encouraging further take-up, and we will be doing our utmost to manage the issues that materialise in terms of vaccine availability during April. Thank you.
Neil, Thank you very much indeed. I think, you know, I'm still waiting for mine. I'm fortunate at the moment that I'm still not of a certain age, so you know, I shall keep my fingers crossed for when that eventually does happen. The feedback that I'm getting from residents and from friends is incredibly positive about the way that our NHS partners have dealt with the issuing of the vaccine. So, you know, Neil, please pass on our thanks to colleagues on the front line that are jabbing away like good what. And interestingly, you know, mixed feedback about the reactions to it. You know, I've had some just saying, you know, they've just had a sore arm, which is expected, and a few people that have been you know, sort of in bed for a while. So it's, you know, it's interesting how it affects everybody in different ways. But you know, it's all to the good, and we just continue to really push out the message of, you know, getting people vaccinated when they're, you know, when the time, you know, when they are due to have their vaccine. So Neil, again, got two hands raised, Councillor Ridney and Matt Bowsher.
Thank you, Chair. Neil, I just wanted to know, and again, reiterate what the Chair has just said. Most people are very positive about it, very efficient. I had mine at the Black Country Living Museum, very efficiently run, no problems at all. And that's one point just concern me. Will that continue to be a vaccination centre as we move through the next couple of months? Because I know that they're planning to reopen as a visitor centre, aren't they?
Yeah, so they're planning to reopen in the middle of May to a limited extent, and then more extensively towards the end of June. They've also said that they no longer want us there basically from August, because they'll be you know, running at sort of full capacity by then. So we've had a meeting on site with them yesterday about that, just trying to understand the way in which patients can continue to flow through the site and the way in which visitors will flow through the site. It is going to present some challenges, to be quite frank. We've got a further meeting about that tomorrow, and we'll have to come to a conclusion as to whether or not we can stay there right up until August based on those discussions. Having visitors and patients on site at the same time isn't going to be easy, so we need to make a decision about that.
Thanks for that. And just another comment. A lot of are there, just to reiterate, it is okay that people will be all right for their second doses, because I know people like myself, I've got an appointment booked at the Black Country Museum for my second dose, as is my husband, but other people in the communities, there is no going to be any difficulty during April on people receiving their second dose? No,
there are a number of people booked in for their second doses at the Black Country Museum that, in effect, in the latter 2 weeks of April, the Black Country Museum will start giving their first lots of second doses, because the Black Country Museum opened on the 25th of January. So we just get to that point at the end of April. So the message given to us this morning was that vaccine supply for second doses in April is secure.
Okay, thank you for that. Thanks.
Thank you, Councillor Ridney. Matt.
Thank you, Chair. This has been a very, very complex logistical exercise, and the CCG and partners have done a brilliant job here. The approach to the care homes was fantastic. The quick readjustment when people with learning disabilities were added to the priority list was, from the feedback I've had, seamless and well managed. I think, proportionately speaking, we're doing very well in terms of numbers when you benchmark to other areas in the West Midlands. And we've now got a very effective process up and running and implemented for informal carers as well. So I think this is a testament to the local response. I think it's working really well. And clearly, the impact that the vaccine is beginning to have now is definitely showing in the infection rates. It's also showing in terms of admissions to hospital and the decrease there. And critically, the numbers for the over 60 population are decreasing consistently. What we now need to do is monitor the impact of the schools reopening and also monitor the impact of visitations at care homes, which was reinstated recently. Just to update the board, as of 8 o'clock last night, we had 18 active outbreaks of COVID infection in care homes in the borough, and that number was down significantly from a fortnight beforehand, where we had 35 active outbreaks. So what we're looking for now is a safe, sustained decrease and a decreased transmission in the care home settings. But I think all credit needs to be given to everybody involved in the local vaccination programme, particularly the CCG for the leadership role that they played on behalf of the rest of the borough.
Thank you very much. I've got no other hands raised. So again, I think, we continue to note the excellent work that is being done as part of the vaccination programme, and long may it continue that we get everybody vaccinated as quickly as practicable. So Neil, again, thank you for your report. Very positive indeed.
Thank you.
So moving on now to item 7, and that is an update from the BAME Communities and COVID-19 subgroup, which is Francis.
Thank you, Chair. And also I've got Siraj Norman with us, who's the interim chair for the subgroup. So just in case she wants to mention anything, she's with us as well. It was just a report, hopefully you can all see, just to update board members on the progress of the group, just to let you know that it's now been formally established and had its first full meeting at the beginning of March. And there are a few messages that the group wanted to share with the board in terms of ongoing support and recognition of the work it plans to do. Those are in the front sheet of the report, and I can just highlight them in a moment, but just to let you know that we've got reasonable representation as we begin, but we do want to invite more and more members to be part of the group because we want to hear as many voices as possible. We recognise that there's a huge diversity in the community of Dudley, and interestingly, as we approach census weekend, we might get a bit more accurate data about those communities. It would be really good to hear as many voices as possible. So the group members themselves are out there kind of scouting for new members or people to get involved. And we also would ask members of the board if they're aware of others who might be a good play a role in the group, to please encourage them to join. We plan to have both a group that meets regularly, but also a broader reference group. So for those people who don't feel that they can commit a lot of time to meetings but want to be part of the conversation, we want to open that up. So that's one of the key messages I think we want to share. The group were very keen to identify key points, and the 4 identified in the report are the board to note that in addition to the impact of COVID-19, our BAME communities have been experiencing long-standing inequality, and to recognise that to address this is going to take a long time. Obviously, we want to see progress and we'll do everything we can to encourage that, but we don't expect it to be resolved very quickly. We want that work with BAME communities to recognise the breadth and diversity of the group that we have in our borough, and that the response to some of the issues will be different according to each of those communities. And I think we found that out interestingly in the work we've been supporting around vaccination and uptake amongst BAME communities, that there are very different reasons why people are reluctant to take up the first offer of the vaccine. The work that Tandrust has been doing has helped us identify some of those key differences, and I think that's there's an important lesson in how we take this forward for the subgroup. We do want to support all action that the board takes around vaccine hesitancy, and perhaps now we start to need to revise our description of it and talk about building confidence in the vaccine, especially as we start to move down the age groups, and again different issues start to appear in relation to people still being a bit unsure about vaccine uptake. And quite a major area that we want to concentrate on is that of data and its accuracy. There are lots of organisations in the borough collecting data, some of which is very precise and some of which isn't, and we really need to get to grips with how we produce the most comprehensive and most accurate data to reflect the needs of these communities we're trying to serve. So those are the 4 key areas that the board, the subgroup wanted to bring to the board. So I don't know if Suraj, you want to say anything in addition?
Thank you, Fran. Chair and members of the board, as the interim chair and on behalf of the subgroup, we do welcome the opportunity to work with the board and not only on those COVID related matters and the impact or the particular impact on those Black, Asian and minority ethnic communities, but on the inequalities that will remain as they were there before once COVID related matters are dealt with, that Fran has just outlined to you, and as we've heard from the report that Suzanne put up for you. So I think there's lots to do, and I think we've set an ambitious work programme, but we do look forward to working with the board to help tackle those issues for the benefit of those communities. And particularly the work on the immediate future, the post-COVID health needs of BAME communities, which will be greater given the greater impact, and on the BAME vaccination uptake. Thank you.
Just help if I unmute myself. Sharaj, thank you for joining us this afternoon. I think I'll let others come in and make their own observations and comments. I think vaccine hesitancy, I know, is a word that, is a phrase that I think, being advised not to be, it is around having that confidence, having the vaccine, and again, tailoring the messaging to where there does seem to be, concerns about how efficient the vaccine is, and all the stuff that is coming out. So again, through the subgroup, I think you're doing some very important work around that. So that's very much appreciated, and I think it's quite key that moving forward, obviously this is the last meeting of this municipal year, but certainly moving forward, that this becomes a key item on our agenda, and also forms a greater part of our recovery plan, and data, again, which was referenced, is so important that if we haven't got the right data, or we've got out of date data, then you can't do your job properly, and you can't target the audience that we are trying to capture. So we've got to have confidence in the data that is being presented, and that's the same, right across the board, whether it's for this or for any purpose of any reporting. That's absolutely important, and it's also about having the confidence of sharing it as well between partners. That we've got the appropriate arrangements in place to be able to do that. So again, it ensures that we can all do our jobs more effectively. So again, that's certainly an important piece of work. So Sharad and Fran, thank you very much for a very positive report, and we will continue to support that. So I've got a couple of hands raised. I've got Chris and then Kim Madill.
Thank you, Chair. So I just wanted to have it documented formally that actually the primary care community GPs across Dudley are hugely thankful for the work that Fran and the wider team that she's brought in to help us deal with vaccine hesitancy have done. It's really valued by them, and actually I know that the team which Fran has brought in to help us with this programme are being effective. They are getting out to parts of the community that we haven't managed to get to and get a real positive message out to them. So can I just have that sort of formally logged in the system, please?
Thank you.
So we lost our chair.
It would seem so.
Yes, I think we have. I've got a connection this end as well. So
sorry,
oh,
I am sorry about that. No, I know something just went crash behind me, so apologies for that. I've got. Sorry, I'm having a good day. Kim Medill.
Hi, yeah, thanks, Chair. Just wanted to thank both Fran and Saruj for the update, and just to say you're probably aware that whilst I sit on this board and you're a subgroup of this board, I also chair the Safe and Sound Board of the Community Safety Partnership. We currently have all of the priority leads looking at what their plans are for next year in terms of community safety, and a golden thread through each of them is going to be diversity and inclusion and kind of disproportionality issues. So I hear you were both keen to stress that there are lots of issues that were there pre-COVID that you are really committed to kind of working on. One of the priority leads is also on this call. It's kind of Paul Davis, who leads the community cohesion piece. So it's an offer really that where the matters don't necessarily fit the Health and Wellbeing Board agenda, I would be really happy to take those issues into the Community Safety Partnership space as well, and make sure there is a kind of joined up programme of work through the things that you are identifying with that really valuable group of community that you're working with.
That's great. Thank you very much. Yes, by all means, we would want to be in touch with you.
That's very helpful indeed. Thank you very much for that that offer. Any other questions from board members? No. Great. Thank you both very much indeed for that presentation.
Sorry to interrupt. I've got
extremely helpful. And agenda move. Oh, Fran, did you want to come in? Sorry.
I think Karen.
Oh, it's Karen.
Oh, it's Karen. Sorry, Karen.
So, apologies, I just have to just dip off for a moment. I've got in terms of, and I may have missed this discussion, but I think in terms of moving forward and recognising it's important that we build confidence around all immunisations and vaccinations. I would really like to see us take this opportunity to see what are the members across our communities that could be trained as vaccinators moving forward. As you know, they have done some in other areas, and just it'd be great to see what the kind of the support of the board was doing that. So that it's that kind of concept of somebody from my community being involved in that process. And I think that will help us around inequalities moving forward. And it'd be great if it's possible to get any support for that from from our colleagues. Thank you.
Thank you, Karen. Absolutely support that. I think whatever additional support input that we can provide, with this, we need to consider. So I can't see any other hands raised. So on that, thank you both again very much for your presentation this afternoon.
Thank you, Chair.
Thank you both. Thank you. Look forward to hopefully seeing you in the new year ahead of us. Right, moving forward, we've got the Health and Wellbeing Strategy, pages 88 to 95, and Julia, I believe you're presenting on that.
Yes, that's right. you'll be aware, I've actually circulated the existing health and wellbeing strategy with the papers, and you'll be aware of the fact that 2022 is next year, obviously, and we would normally be starting to think about the rewrite of the strategy at this point. Prior to writing the existing strategy in 2017, we did hold several development sessions with an external consultant that involved not just members of the board, but also a whole range of colleagues from other organisations, voluntary sector, the community, so that we could get a really diverse input into what we thought the Health and Wellbeing Board strategy should look like. And it just feels like it's very timely to just flag this up at this point in time, given that we only meet 4 times a year. We haven't got that many meetings before we would need to restart the rewrite of the strategy. And given that we're talking a lot about the reset of the Health and Wellbeing Board's work as we come out of the COVID crisis, it just seems opportune to just start to think about, in the context of how we move forward coming out of COVID, what have we learned and what is still relevant from the existing strategy that we might want to take forward with us, and what we perhaps need to move on from. So we just felt that it would be useful today to just very quickly recap through the context of the existing strategy, because many of the existing board members weren't board members when we wrote the strategy 5 years ago, and so we just felt it would be a useful starting point to give everybody an opportunity to think about the future, and also at the end of this to decide whether perhaps we might want to set some development sessions up that incorporate some of the things we need to think about moving forward generally in terms of COVID, but also in the context of what that might mean for the future strategy. So if I could have my presentation up, please, Helen. Thank you very much. So as I said before, the strategy is up for review in 2022. So if we can have the next slide. Seem to have a bit of a technical hitch here.
Yeah, sorry, can you see those slides at all?
We can see them, but we can't actually, they're not in slide format, it's just the...
Yeah, can we maximise those, Helen, onto the slideshow?
Yeah, bear with me just 1 second. I'll just try and do that.
I'm glad it's not just me.
There we go.
I know. Can you see that now?
Yeah, we can, thank you. Can you move on to the next slide, please, Ellen?
Yeah.
Fantastic.
Thank you. Right, okay.
Thanks,
so
thank
you. The context of this then, as I've already mentioned, we had a number of development sessions, and as a board, there was a commitment made to developing a new way of working and a need to nurture a different sort of relationship with communities. There were a lot of board members at the time who were getting quite frustrated about the fact that we were having a lot of well-meaning conversations at strategic level, but actually that wasn't really having much of an impact on the health and well-being of communities, and that there was a recognition that we needed to open these conversations up and to actually think about things very differently. And in line with that, there was a recognition that if we were going to achieve true change, we needed to shift the power base, that we needed to move away from a situation where strategic organisations made most of the decisions and had control of much of the resource that was available around health and wellbeing, and to shift that power base to communities so that we actually had meaningful conversations with people in the borough whose lives we were talking about in terms of health and wellbeing. And linked to that, there was a recognition that we needed to change the way that we commission services. So we needed to move away from the traditional commissioning where we had a pot of money, we went out to tender, we invited tenders, we had long, complicated documents that people had to fill in order to access money, and then made a judgment about who did or didn't get that money. So that was the context in which we were moving forward. We really wanted to see a significant change right across the system in order for us to be able to do things differently. Next slide, please, Helen. Okay, so what we came up with were, based on the information we had available as part of the JSNA, were the 3 goals that you see here: promoting healthy weight, reducing the impact of poverty, and reducing loneliness and isolation. And in addition to that, then we had 4 key principles. So next slide, please, Helen. That we wanted to work towards. So we wanted a new relationship with communities, as I've already mentioned, a shift to prevention, a stronger focus on joining up health and care services so that it was a seamless process, and a stronger focus on what the strategy achieves. Okay, next slide, Helen, please. So the way that we decided to go about that was we revamped the way that the strategy looked. So we made it much shorter, much more easy to read, but we also invited everybody in the borough to play an active part in this process, so that it wasn't just about those people sitting on boards or steering groups that got to influence this. We did this by identifying three themes, if you like, or 3 things that we wanted to focus on. So there were things that we recognised if we were going to be tackling the health and well-being of, or improving the health and well-being of the population of the borough. There were things that we as statutory organisations only we could do. We still had to go ahead and do those. But there were also lots of things that individuals and communities could do for themselves and each other that didn't need us to get involved. And that's something that's been reflected really strongly during COVID. We've seen individuals and communities really step up and sort things out for themselves, resolve issues, use resources that are available to them in very effective ways. And then we recognised that were the things that we needed to do together. So statutory organisations and communities working together had skills and resources that if we pooled those, we could really make an impact. And again, we've seen really positive examples of that during COVID. Next slide, please, Helen. So what we did was we started by listening to stories. So we had an external organisation come in to work with us, and what we did was we invited hundreds of people in the borough to tell their stories, and these are people that we didn't normally hear from. There were people out in communities who had got things they wanted to say about what they thought was important in terms of maintaining their health and well-being. So if we go on to the next slide, Helen, we can see that there were 7 key factors that came out that they felt were very important. You don't need me to read them all out, but you can see there's nothing there that is particularly rocket science. But what's really interesting is that what they were suggesting is that this is what we should be focusing on. Whereas from a strategic point of view, we were tending to come at this from our 3 goals, our tackling healthy weight, obesity and loneliness and isolation. It's not to say that those aren't important, but actually when you talk to communities, they were coming at this from a very different perspective, which taught us a lot about where we needed to start. And so what we did was we used these 7 themes throughout all the work that we were involved in throughout the next few years in terms of health and wellbeing, in relation to the Health and Wellbeing Board at least. Next slide, please, Helen. So we then embarked over the next few years on a range of projects that listened to those 7 themes, but also took on board the principles that we'd identified we wanted to work towards as a board. That's having a different conversation with communities and shifting the power base. So we had projects like Make It Happen, which some of you may be aware of, where instead of the traditional commissioning approach, where we've got a pot of money, how do we allocate this, who's going to apply for it, we actually opened that process up and invited community groups to bid for small pots of money that they could use within their communities. What they did was they came and did a pitch, a bit like we see on Dragon's Den, to a group of fellow members of communities, and the decisions about who got the money were the pots of money were actually made by that group themselves, the audience, if you like, not by the professionals that were involved in the process or the commissioners. So that was a really positive start. It went really well. We had lots of projects that were funded through that process, but more importantly, we had some really interesting conversations and we learned a lot about how we could work differently. Moving on, I've already mentioned the storytelling project, but moving on, we then took that a step further, and many of you will be aware that we then instigated the Voluntary Sector Innovation Fund, which was the same sort of approach as making it happen, but we had a pot of £3 million, which over 3 years we allocated to 45 projects. And those projects access the money in the same sort of way. We relaxed the process for applying for funding. We got rid of all our commissioning forms and complicated systems. And actually, we invited projects to tell us their story, submit a canvas that told us what they were trying to do, why they were trying to do it, how they've got their community involved, and how much it would cost. And then we set up panels represented by, we did have some of the local authority staff on there, but we also had voluntary sector involved, members of communities, and other statutory bodies represented as panels who listened to the pitches and then decided where the funding would be allocated. And this was a really powerful piece of work because communities really stepped up and came up with some brilliant ideas. And what we then found was that they started to link up with each other, and we started to see resources being used in a much more effective way, and community groups supporting each other to share assets and skills to actually spread their experience and their conversations much further than we would have done had we done this in a traditional way. And following on from that, what we did after that was, rather than have the usual quarterly reporting process with a set of figures, we allocated each successful project a project sponsor. Many of those were local authority staff, but there were also some voluntary sector staff as well that supported projects. And they worked with the projects over a period of time to help and support them, whilst also monitoring how they were getting on. And as a spin-off from that, what we did was, moving on to the next point, was set up communities of practice, where we had representatives from the organisations and their sponsors working together on a monthly basis for a year, looking at what sorts of skills we needed to develop to work differently, and what does co-production really look like, and what can we do to support each other. And what we found was we got a really rich group of individuals who are buying into this process and taking that then back to their organisations and sharing it. And much of that is what we started to see in really positive ways once we hit the COVID pandemic, because we started to see some of these communities that we've been working with stepping in and organising things, linking with us in a different way, having different sorts of conversations with us about jointly how we could draw funding in or how we could support each other. So it really illustrated to us that the work we put in so far was starting to achieve what we set out to achieve, was to develop a different sort of relationship with our communities. And following on from that, we've had a number of examples where we've continued the participatory budgeting. So that's where we have a pot of money. We invite communities to come in and bid for the money, but also to decide themselves which of their community groups should be allocated money. So in terms of shifting the power base, it's shifting those decision-making processes away from the statutory sector and putting them into the community. And the culmination of a lot of this has been the Cluster Connect project, which has been running as a pilot in central Dudley for the last 2 years. And basically that's a distillation, if you like, of everything that we were trying to achieve within the health and wellbeing strategy, and pulling it together into one project that's focused in a locality. And this project brought together a whole range of individuals within Dudley, within central Dudley. So that's faith groups, voluntary sector, local community members, members of public health, commissioners, a whole range of organisations, local businesses as well, elected members, who all came together to share their experiences of what were the real issues within that locality. Not the issues that we get from the JSNA, but the real issues that affect people's lives. And what resources had we already got in the borough that were working well that we could build on, or where had we got gaps that we needed to fill? And it really has been a fascinating experience, and has thrown up so many benefits that have helped us through the COVID crisis. When we realised coming up to Christmas that we'd got real issues for significant sectors of our population who was struggling to get hot meals on a daily basis, we were able to use the experience and the structure that was set up within Cluster Connect to quickly access help and support from the voluntary sector for this particular cohort, and then roll it out to the rest of the borough. So it's just a really, really good example of everything we were trying to achieve with the health and wellbeing strategy. Its success now is spreading, and it reports back, or has reported back recently, to the early help strategy group, and the agreement was made to roll it out to the other 4 townships in the borough. So it's already very active in Dudley North. The work that needs to be done to identify the members and to the conversations with the community have already started there, and in fact I think are nearly complete. We've made great strides in the Hellzone area as well, and I know that there have been conversations between a couple of the team members and the chair, Councillor Barlow, about the Stourbridge area. So it's really about thinking in terms of moving forward. Everything we've talked about, everything that was in Susie's report earlier about what are the key issues we need to think about moving forward coming out of COVID. How do we use what we've learned so far as we move forward, and what does that look like in terms of our next health and wellbeing strategy? And Helen, if I could have the next slide, please. There are key things that we've learned from this process. There are lots of things that we could pull out in terms of evaluating successes. There's so many projects that have achieved so many things and have told us all about it. But in terms of moving forward on a system-wide basis and thinking about not losing all the progress we've made so far, there are some real things that we need to bear in mind when we have discussions and development sessions about what we do next. And these are that we need to focus on the assets rather than deficiencies. Certainly from a statutory sector point of view, it's always been traditionally very easy to focus on the deficiencies and what do we need and what's our responsibility to do to fill them. But actually what we found is focusing on assets is a much more positive approach, and things grow quicker that way because you're already building from a positive basis. To focus on the opportunities rather than the problems. COVID has given us lots of opportunities in communities, things that have worked brilliantly well. Let's not lose that. Let's move forward and build on it. And we've also learned that this isn't about individuals. We've tended very often in the past to focus on individuals and what their needs are, quite rightly, because we believe that every individual is important. But actually what we're seeing is that communities and neighbourhoods working together can achieve a lot more than individuals on their own. We also have looked and worked with people as citizens and co-producers rather than seeing them as clients of the services that we offer. And I think, again, that's been really powerful. The community members that we've been working with are the ones that are on the ground experiencing this on a day-to-day basis, and they've got so much that they can contribute to the conversation and the planning. And I think it's the next one is one that we've perhaps thought about a lot in the past, but not necessarily seen it happening in reality, is that we're about developing potential within communities, not fixing people and problems. It's about a shared process that's organic. It's not a sort of project that we've got a start and an end to. So the potential that we've seen in communities has been quite phenomenal. And also, just to summarise something that might seem obvious, but it's, again, with COVID, it's been so powerful. People are the answer, not programmes. We've seen so many people step up in communities during the COVID crisis, but before that, with fantastic projects based in communities, they haven't needed programmes with complicated plans and starts and finishes. I think sometimes we've been in danger of, whilst trying to do a really good job, making things too complicated, and that actually we need to start with the people and let an organic approach enable projects to develop as the needs of communities become more obvious. So in terms of where we're at now, that's just a quick run through of everything that we feel we need to take into account from the previous or the existing strategy before we move forward. And I think all we're saying at this point is that's a start. How do we move forward in terms of what we've got to do for the reset of the board around COVID, and how do we link that into what we've learned from the existing strategy? What does it mean about what the strategy will look like in 2023 onwards? Thank you, Chair.
Thank you very much, Julia. I think we've seen so much happen with the involvement of our communities over the past year, but also before that, where you mentioned about the voluntary sector innovation fund, and having been involved with that, it's an incredible initiative that the council put out there, and seeing what is available out in our communities, and they are best placed a lot of times to actually tell us what we should be doing, because they are on the ground. They can see what needs to be done, where there are gaps, and where there are gaps, that's where we as a local authority need to be coming in. But I think it is having that collaborative approach, in a reboot as we move forward. So Julie, well done on presenting that report. Councillor Buttrey, you've got your hand raised, so over to you.
Thank you very much, Chair. Yeah, just want to echo, fantastic report, Julia. I mean, it just summarises it so beautifully. It's not doing to people, it's doing with people, isn't it? And I think from a children's perspective through the last year, I cannot thank the team enough as they've worked with our voluntary sector to keep our children fed and occupied through the school holiday, well, through term time as well. I know you can't single out individuals, I realise, but I know with like Revival Fires, they just started up a holiday programme in the February half term just before the lockdown. Lockdown happened and they immediately changed their model and changed how they worked with our disadvantaged young people. I mean, I know Paul will come on to it with the safeguarding, but actually our biggest area of deprivation is actually white working class boys. And we're now, experiencing issues with them being drawn into county lines and that kind of thing. So if we can keep them busy and keep them occupied, then hopefully there's less chance of them falling into the wrong path. And you're absolutely right how we use the community. They came up with a lot of the innovative ideas, and we just had to support them all. Like I say, with the excuse me, moments. I'm sorry. And with the sorry, my husband's in the room as well, so too many people working from home. So with the with the young people, getting them fed and just supporting the teams. And I think when we set up the COVID helpline, again, that was a really good piece of partnership work where we realised that school vouchers isn't necessarily one size fits all. And by having the helpline, we could then triage people through. And I think between Julia, Nikki Burrows and Helen Ellis, they set it up. Had a phone call with Helen at like 7:30 on the Monday morning, and by 1:30 she's like, we've got the strategy, and by 9 o'clock Tuesday morning it was actually operational. So it shows, I think, like Julia says, we can learn from that, and we don't want to lose that. And I know previously, so when we had the free swimming, I know a lot of my colleagues in the leisure centre were like really pleased because it's actually brought in communities that didn't usually access the leisure centres and that kind of thing. So it's sometimes very simple initiatives that have a very powerful impact. So I just wanted to say, fantastic work done by Julie, but what she says about the report and how this board should be set is absolutely spot on. So thank you very much, Chair.
Thank you, Councillor Buttrey. No, absolutely. Echo your comment. Really, look at how we, as a council and how partners, how we all interact with each other, and what we can continue to offer our communities and our voluntary sector partners. You know, they are absolutely critical. I know Andy Gray is on this meeting. So Andy, you know, huge thanks to everybody at Dudley CVS for their incredible input in supporting us and others, you know, through this through this pandemic. You know, it's we owe you a debt of gratitude, I think, you know, for everything that's been done. Karen Wright, do you want to come in?
Yeah, I mean, yeah, again, absolutely brilliant piece of work, and I think just taking us forward, just to kind of remind colleagues that we're putting together this local outbreak management plan, which is absolutely a celebration of some of the work that Julie has talked about there, but also setting the way forward, and the fact that in terms of the innovation fund, as an example, we want to do more of that moving forward and building on that kind of agile approach, but absolutely working with communities and understanding both where the amazing strengths are, but also those challenges moving forward. So we can have some really good plans, I think, that will really support the work of this board in being able to respond to local issues, but really build on the amazing strengths that we've also got within our communities. And I think that's something that we can pick up as a board moving forward. Thank you.
Thank you, Karen. In terms of moving forward, I think I know development sessions were mentioned, and I think that is probably something that we need to consider once the new board, you know, the next board is set up in the new municipal year. But I think we need to have conversations at a much smaller, at a lower level, and certainly looking at some public engagement sessions, because they are usually well attended. A lot of useful information comes out of it as well. So I think, you know, we've got a lot of opportunities that we need to seize on to refresh the strategy. Perfect time. The existing work that we, you know, that's embedded through, you know, looking at loneliness and isolation and obesity, all valid topics, you know, at this very moment. So we need to work on that and absolutely work with our communities and voluntary sector partners. As Julia mentioned, I've had a conversation around the Cluster Connect being established in Stourbridge, so some very positive discussions. Again, I think there's huge potential with getting that, driving that forward, you know, out to other townships. So again, some great work out there. So members, any other comments or observations that anybody wishes to add in? No. Okay. Unfortunately, I can't bring the report up, so I can't. Oh, Councillor Buttery.
Sorry, Chair, I did forget to ask one thing. As obviously so I'm sure it's part of the roadmap anyway, but I'm just thinking, as we're talking about voluntary groups and how as a health and wellbeing board we support them, as we come out of the restrictions, and obviously Dudley is very blessed with lots of, you know, elderly lunch clubs and play groups and all that kind of stuff, most of which have not run for 12 months physically. Obviously a lot of these will want to restart. Will we have a team that can support our community groups as they reopen without it being too sort of burdensome? If, you know, I know they've got to obviously do things safely, but equally some of the legislation that came out previously was sort of more detrimental to their opening than encouraging their opening. And when you're talking about, you know, these are volunteers who are just giving up a few hours every week to run, like I say, an elderly lunch club or a Moms and Tots play group and that kind of thing, we can't have something that's really burdensome and cumbersome. So it would just be a sort of a request that as we come out of this, that we have some really clear but very simple and non-burdensome ideas that we can put out to the local community to really encourage these groups to restart again, so we don't lose them, we don't lose the scouts and the guides and all this kind of stuff, because if the rules are too cumbersome, then we will lose them, which will be an absolute tragedy. So thank you.
No, good point. Thank you, Ruth. Karen.
Yeah, absolutely. I mean, we're actually strengthening the teams that we've got out there to be able to support businesses, voluntary organisations, so that they are COVID secure and be able to open. And I think it's really important that we do build that kind of resilience in community. And as a guide leader, I'll have my own kind of instructions from the guides and what I can and can't do. But no, totally supportive, and that's what this local outbreak management plan as well is all about, to assure, you know, our communities that we're ready to do that, and we will do that. Thank you. Really good point there.
Chair. I think
Chair,
Andy Gray.
Yeah.
I think Andy Gray's requesting to speak.
Andy, do you want to speak? Because I think Councillor Barlow's struggling to be heard.
Yeah. Oh, it does help. I am so sorry. I'm muted myself again. It's this blooming device. I do apologise. Andy, let's try again.
Sorry, Councillor. I'm only catching every third word, unfortunately. So I did hear Karen ask. So it was just to support Karen's observations, really. So during the mini lockdowns we've had, we worked really closely with public health team to provide support for organisations on the rules, the regulations, and their reopening safely. So we propose to do that again going forward. And just sorry on the previous item, just the stuff that Julia spoke about. I really support Julia in the idea of us having some development time, because from what we're finding with the people we work with, obviously the world looks markedly different to the last time we sat and developed a plan. And I think we really should be listening and hearing what's coming up from the many networks that we're all part of. So we've got in our business plan for this year to develop those 5 locality areas that we've been talking about, and listen to communities, spot the gaps, and listen to the needs of local people. And I think that's going to be critical in feeding that into the refresh. So very supportive of Julia's report.
Thanks, Andy. I also see in the chat bar that Jane Emery from HealthWatch told People's Network engagement. And so, Jane, I've no doubt that we will take you up on that offer. So thank you very much for that message. Okay, right, moving on to the next item, which is a verbal update on the NHS white paper. And I know that ties into also the 2 sets of presentations that we're going to have a quick discussion about after the formal business. So, Neil, back to you.
Thank you, Chair. I think I've got some slides which I'm hoping I'll be able to share with you. Has Helen got those?
Yeah, I can do those for you, Neil, if you want.
Okay, thanks very much,
Hopefully.
Helen. Essentially, Chair, as people may or may not be aware, a white paper was published about a month or so ago now, which deals with some proposals to be included within a new NHS bill to reorganise the NHS. And I guess one important piece of context for this that the board may remember is that back in the autumn, we talked to you about a proposal to create a single CCG for the Black Country and West Birmingham. That proposal is coming to fruition now. It's been approved by NHS England. And from the 1st of April, there will no longer be the Dudley CCG, will be part of the Black Country and West Birmingham CCG. And we'll probably talk a bit more about that in due course. But that does provide a little bit of context for these slides as well. So if we could have the first slide, Helen. So for those of you who are interested in a bit of history, this is some recent NHS history, well, recent in the sense that it goes back about 30 years or so, in terms of the changes that have taken place going back to 1990 and what was then regarded as the purchaser-provider split and the establishment of what became known as the internal market. And I've tried to just describe there some of the major changes that have taken place since 1990. Whilst there have been a number of changes, a number of elements from those changes have remained. And as you'll see on the next slide, there are some consistency there. So commissioners and providers, independent NHS organisations, whether they be NHS trusts or foundation trusts, commissioning bodies, whether they be health authorities, primary care trusts, CCGs, all operating in what was regarded as a managed market. The use of contracts for holding organisations to account for delivering services, and a relationship with councils, who of course provide a number of services that do have an impact on health, but organisations which themselves are independent statutory bodies and have a different line of accountability to the NHS. So whilst there have been changes over the past few years, a number of elements have been consistent. You may remember the 5-year forward view that came out a few years ago now, and then latterly the NHS long-term plan, which came out 2 years ago. In there, mention was made around what were described as new care models based around integrating services. As a result of that, Dudley became part of what was then called the Vanguard programme, and that was the basis for the development of what we call the Dudley multi-specialty community provider, what we now call the integrated care provider. The long-term plan in chapter 1 committed itself to the development of new care models, and it also flagged up the need to have some legislative changes, greater cooperation within healthcare systems, less transactional relationships, and a different style of contracting, and a move away from the kind of competition of the internal market to a more cooperative mode of behaviour. There are now a number of themes contained within the white paper that's been produced that build on some of the issues that were described both in the 5-year forward view and the NHS long-term plan. So moving towards more integrated care systems, and the sort of system that we've seen established in a number of areas that will be established in the Black Country and West Birmingham, putting those on a legal footing, trying to create a responsibility for greater integration and greater shared working, giving integrated care systems the statutory duties that are currently held by CCGs, and CCGs being abolished in effect, giving organisations a duty to collaborate, and giving local authorities representation on the governance arrangements. And also, quite an important issue for ourselves, these integrated care systems being coterminous with local authority boundaries. And for the Black Country and West Birmingham, that does present a little bit of an issue in the sense that our boundary isn't coterminous with all the local authorities, because we've got West Birmingham included. I'll come back to that a little bit later on. So in terms of having a statutory body, a statutory integrated care system, in essence, that will be made up of two separate components, what's called the Integrated Care System NHS body and the Integrated Care System Health and Care Partnership. The NHS body would be responsible for the day-to-day running of the NHS, and to all intents and purposes would replace the CCG. The financial objectives of the ICS would be set at an ICS level rather than necessarily at an individual organisational level. The ICS Health and Care Partnership would be responsible for developing a plan that addresses all the health and social care needs of the local system. and the ICS NHS body and local authorities would be required to have regard to the partnerships plan when making their decisions. There would be a fair degree of flexibility within that arrangement in terms of what happens within a local place like Dudley, and how we operate within that kind of system. That's something that we'll come back to a little bit later on. But the main sort of purposes of that system would be improving population health and healthcare, tackling health inequalities and uneven access, dealing with issues around productivity and value for money, and dealing with broader issues around social and economic development within that system. Just in terms of the statutory duties, I won't sort of dwell on these too much, but as I say, this is about creating a different statutory system. The statutory duties involved are outlined there. The one that's perhaps just worth talking a little bit about, noting, is this shared duty to have regard to what's called the triple aim. So better health and well-being, better care, and a sustainable use of NHS resources. That doesn't exist at the moment within the statutory duties of any NHS organisation, but the bill would create that as a specific statutory duty. And then also just noting that final bullet, reciprocal duties placed on both the NHS and councils to collaborate. So just in terms of place-based arrangements, as I say, there are no legislative arrangements proposed for what might happen at place. There are descriptions within the white paper about having flexibilities as far as local arrangements are concerned. But I think the important thing to note from the perspective of this board is that the role of the Health and Wellbeing Board remains. So the Health and Wellbeing Board at a place level remains responsible for the production of the Joint Strategic Needs Assessment. It remains responsible for the Joint Health and Wellbeing Strategy. And as I mentioned earlier, integrated care systems will need to have regard to health and wellbeing boards, to the Joint Strategic Needs Assessment, the Joint Health and Wellbeing Strategy when they're creating their plans. Just in terms of the governance arrangements of the ICS NHS body, which I think is on the next slide. So that would have a board, bearing in mind that the CCG disappears and the ICS NHS body takes on the CCG's commissioning functions. That board would have representatives on it that are not inconsistent with what a CCG governing body looks like at the moment, but it will be extended to include NHS trust representatives, GPs, local authority representatives, and so on. As I've indicated there, its main responsibilities are around producing a plan to address the health needs of the system, the strategic direction of the overall system, and also capital spending, something that tends to take place within individual sort of organisational silos at the moment. That will become the responsibility of the Integrated Care System NHS body. Just bearing in mind, of course, that this would be at a Black Country and West Birmingham level. It wouldn't be at a Dudley level. The ICS Health and Care Partnership, that would have a wider membership than the ICS NHS body. It would be there to address the wider issues. Again, there'll be a degree of flexibility about how the membership of that body is made up, but again, it'd be very much around partnership and collaborative working. Have the next slide, please, Helen. So just thinking about this in terms of what that means for changes within the system. On the left-hand side here, I've looked at what the Black Country and West Birmingham system will look like from the 1st of April 2021. So as I mentioned earlier, we'll have a single CCG, Black Country and West Birmingham CCG. That will be part of the Black Country and West Birmingham STP, Sustainability and Transformation Partnership, which is moving towards becoming an integrated care system, albeit at the moment that's not on a statutory basis. For acute hospitals, the Black Country Healthcare Foundation Trust providing mental health and learning disability services. Within Dudley, the Dudley Integrated Health and Care trust providing our local integrated place-based model, the Birmingham Community Foundation Trust that specifically serves West Birmingham, the ambulance service, then 5 councils, if we include Birmingham within that, and 5 health and wellbeing boards. Moving to the 1st of April 2022, when we expect this legislation to take effect, and if we assume that the integrated care system will be coterminous with the local authority boundaries, the ICS NHS body, the ICS Health and Care Partnership, the 4 acute hospitals would remain, Black Country Healthcare Foundation Trust would remain, Dudley Integrated Health and Care Trust would remain, the ambulance service would remain, but then we'd be based around 4 councils and 4 health and wellbeing boards. So that's just to try and illustrate the way in which the system would change from what we have on the 1st of April this year to the 1st of April next year. And then on the next slide, I've just tried to illustrate what it might look like at a local level. So in terms of the 1st of April this year, the CCG, the Black Country and West Birmingham CCG, as I think we indicated when we were first discussing the proposed creation of a single Black Country and West Birmingham CCG, will have a local sort of Dudley-based committee, which will be called the Dudley Commissioning Board. In addition, we've got our partnership board that exists at the moment, and then alongside that, Health and Wellbeing Board, Dudley Group Foundation Trust, Dudley Integrated Health and Care Trust, Black Country Healthcare, the ambulance service, 6 primary care networks, our groupings of our local GPs, the council and our voluntary sector and other partners. From the 1st of April 2022, potentially we'd have a local ICS NHS body committee, a local ICS Health and Care Partnership, and then all the other organisations that exist there. So those are the basic changes there. On the next few slides, we'll probably skip over the next 2 slides, Helen, and then I'll just talk about a couple of things. So in terms of these remaining slides deal with other issues that are addressed by the bill that may or may not be relevant to everybody, but there are some specific things in there about public health. So some proposed legislation in relation to obesity, for example, legislation in relation to the fluoridation of the water supply. And then equally on the next slide, there are some proposed legislative changes in relation to adult social care, power for the Secretary of State to give financial assistance to providers, moving discharge to assessor arrangements onto a legal footing, and so on. So some further changes there that colleagues will be interested in terms of the wider aspect of the bill. So that's it. Essentially, Chair. Moving towards an integrated care system for the Black Country and West Birmingham. 2 statutory elements to that. So the Integrated Care System NHS body, the Integrated Care System Health and Care Partnership. Those bodies still having to have due regard to the work of the Health and Wellbeing Board, the Joint Strategic Needs Assessment, the Joint Health and Wellbeing Strategy, but a greater reliance on cooperation, collaboration, reciprocal statutory duties, and then a degree of latitude in terms of how those arrangements are then reflected at a place level, which we'll probably want to consider as the legislation unfolds once it gets to Parliament. Thank you.
Thank you very much, Neil. Neil, I have to say that those are probably the most comprehensive yet easy to follow set of slides that I've seen around the proposed changes. Based on those slides, I think that the slides, the presentation that were issued out yesterday were really just an extension of what Neil has just presented. So I think there might not be a need for an additional discussion at the end of this meeting, but I'll be guided by Matt and Karen on this. So Neil, thank you very much. You've made that as simple as it could possibly be, and I know that changes into the changes within the NHS are never simple, having seen quite a number of them myself over the years, and I've no doubt that you've seen a significant number as well over in your time of working in the NHS. So thank you, Neil, very much appreciated. Matt.
Yeah, that's a really helpful job. Thanks, Neil. And I might commission you to explain the route map out of lockdown as well, if you can do it that well with that complex a subject matter. Just a few early points from me with this. Firstly, it would be remiss of me to not comment about the fact that there is explicit reference to NHS financial sustainability in the plan, but deafening silence in relation to sustainable funding for social care. These are points I'm making at a national level, but we've long awaited the white paper, and it's a somewhat crushing disappointment that once again there isn't clear thinking and a proposed set of solutions there. Secondly, I think there are obvious opportunities that integration will throw up. I am a little cautious about the setting of governance strategy and the financial envelope on a Black Country and West Birmingham footprint. And I think we'll need to think very clearly locally about how we build the influence of the local ICS NHS body and the Health and Care Partnership to make sure that Dudley's voice is not diminished, and make sure that there is clear linkages between population need and resourcing, albeit in what will inevitably be a larger and more competitive environment. Thirdly, the assurance framework that is proposed for adult social care, we'll be doing some work with ADAS to attempt to influence the form that takes. It's my sincere hope that that isn't assurance through a purely NHS filter, in which I suspect that DTOC is the main currency. And actually, we need to think much more broadly about quality in adult social care and use the expertise that we get from local communities. And I think Dudley Health Watch have a pivotal role to play there. And then finally, and a bit more positively, it is very good to see that discharge to assess will be put on a permanent footing and a permanent expectation, and also that the Better Care Fund planning will be on a longer term cycle and a longer term funding basis. That stops the hand to mouth 12 monthly planning cycles and enables us to properly design and plan for change. So that's some just initial thoughts and reactions, and clearly a lot of work lies ahead.
Thank you, Matt. Councillor.
Thank you, Chair. Yeah, obviously, Neil, that's a huge programme you've just delivered, and a copy of the slides would be really appreciated to go through. Can I just clarify a couple of things? I know we went from the MCP to the ICP, and then the ICP was halted. Does this mean the ICS is the new ICP, or is it a completely different model that's working on?
It's very confusing because the term ICP is used in two different contexts. So it's used to describe an integrated care partnership and an integrated care provider. So in Dudley, the Dudley Integrated Health and Care NHS Trust is our integrated care provider, and we're currently trying to work our way through the regulatory process to be able to award the integrated care provider to that integrated care provider contract to that organisation. The integrated care partnership is a separate issue altogether.
So when this legislation comes in, it potentially, obviously, all things are subject to change, as we know, with anything to do with the NHS and government. Will the ICS then replace this ICP, the commissioned part, or will that remain?
The integrated care provider will remain.
Right.
The ICS NHS body will replace the CCG.
Right. Okay. Thank you. Obviously, there's issues around the budget, and obviously we've got our SEND children. So if we're working more closely together, that would be really helpful, because obviously a lot of our children particularly in the SEND cohort, have very high health needs. So that would be really helpful to be able to work on partnership with that. And the other thing I just want to clarify is public health going back into the NHS, or is it staying part of local council, or is it split?
not as part of these proposals. It's very much still part of local government.
Yeah, because I know there was talk that the public health might go back into the NHS, but they're staying as part of local council, are they, at the moment? Yeah. Okay. Thank you very much. But yeah, a copy of those slides would be really, really helpful. Thank you very much.
Thanks, Councillor Butcher. Oh gosh, I'll tell you what, I'm going to get myself a new set of teeth. Thank you, Councillor Butcher. Catherine, over to you. You got your hand raised.
Lovely. Thank you. Apologies, I couldn't hear you then. Neil, I think that is one of the clearest presentations I've heard on something that is really complex. So thank you, really helpful. Obviously, you might expect a question from me about children, and just want to be crystal clear that when we're talking about the ICS planning for health, public health and social care, that is a specific reference to adult social care. So my question is, what confidence can we have that the health and care needs of children and young people will be dealt with through this new arrangement?
Yeah, I don't think an ICS could come up with a credible plan without including children's services. It's probably my shorthand in the slides as much as anything else, to be honest with you. If the ICS is expected to have, due regard to the joint strategic needs assessment, the joint health and wellbeing strategy, then in many respects, it's up to us to make sure that we give due prominence to children in those documents, so they've got no excuse for not covering children's services.
Great, that's really reassuring, and I really look forward to, I'm happy to do whatever is required to make sure that children are up the agenda. Thank you.
Thank you, Catherine. Karen.
Yeah, thank you again. I know, Neil, it's all been said, but tremendous presentation. So a few things for me are, one, in terms of public health, absolutely, the role of public health within local government, I think, has been shown. It's in the right place just from the last year of the pandemic. And whilst you've got this change going on, you've also got the changes around the development of the National Institute for Health Protection, which then influences what happens with health improvement, population healthcare, health protection, health intelligence, etc. The clear steer that we are giving through the Associate Directors of Public Health and working directly with the central system is the importance of place. So the importance of the sub-region, the importance of the Black Country, and the importance of the local government patch, and that, I think, that is being heard loud and clear. So I think that's really important. I think it's important that we've got one of the consistents amongst all of this actually is the Health and Wellbeing Board, and I think it's really important that we do grasp the opportunity, which I can clearly see we're doing around that inequalities agenda, which is what we've been talking about all along here. And I think with the and there's a strengthened requirement on the NHS in terms of health inequalities. So I think what we heard, that story right from Susie's presentation, which is absolutely telling us stuff we know, but putting it in together, and the developing work so that each of the primary care networks understand what its challenges are around inequalities are, which means we can see that we can be addressing those things right at a PCN level, right through to local authority and that bigger system. So for me, that's absolutely really important, and obviously the JSNA is going to be key to that. And I think for Dudley, there's definitely a strengthened approach to understanding the role of inequalities in Dudley, particularly because of COVID, that we can be holding ourselves to account to say what we do to address them. But some real opportunities in my view. Thank you.
Thank you, Karen. Very helpful. Yes, and having the public health slides, was very helpful by putting those up. So Neil, again, thanks very much for making see that there are numbers for those slides to be shared. So if that could be done, that would be, again, much appreciated. So, Neil, thank you very much.
Would Lisa be able to circulate?
Right.
Yes, Neil, I'll make sure they're sent out to the board.
Right, thank you, Lisa. Thank you.
Wonderful. Thank you. Karen, you've got your hand up again. Is that a legacy hand?
Yeah, it's not up on my screen, so yes, thank you.
No, it's just disappeared. Oh, thank you. Sorry. Right. Okay. I'm conscious of time. On to item 10, which is the Children's Safeguarding Partnership Annual Report for 2019-20, and it's between Helen and Professor Kingston. If he's still on the line, or it might be Catherine.
Professor Kingston, sorry, is no longer present at the meeting, Chair.
Ah, he's left the meeting. Right. And I'm not sure if Helen is on the call. Name on the screen. Catherine, I'm not sure I want to form to note and if they've got any questions to raise. No. Catherine?
Catherine's also have to leave the meeting, Chair. For
right.
scrutiny.
Okay. Well, I think
Matt is going to cover for Catherine if there is any questions.
Okay. Right. I think the reports are there, and obviously, I think that they are more or less to note unless there are specific questions. So, Matt, shall we move on to the Doles update?
Yeah, no problem at all. So just quickly, in terms of Catherine's report, it did go through the scrutiny process last night for those members that are on the committee, and I'll cover both in a very brief update. So the report's talking about the 2019-20 period. Remember a world pre-COVID. It's quite the mental exercise to think back that far. During the pandemic, there's been a weekly exec meeting with all the statutory partners. From the council's perspective, all statutory services continue to operate. We also worked across the system often to redesign our offer rapidly. So patterns and trends in relation to domestic violence changed, and our response needed to change to that. Patterns and trends of abuse, particularly scams, changed. We had scams in relation to provision of PPE and in relation to online offences that we needed to adapt and develop a new offer for. We have maintained a very close performance focus on performance and risk throughout, and we've had to create new services often with very limited notice because of the impact that COVID's had on the borough. We had a very helpful discussion today as a system about the need to adapt our governance structures for safeguarding post-COVID. And there will be a system-wide session for both boards and wider stakeholders to talk through that detail when it's ready, and to hold an engagement session to get feedback from across the system. And I think really that is all to say about those two reports, because they have by now been through both safeguarding boards, they have been to scrutiny, and I'll open it out for any questions that the members want to ask on either report. I say that in the full confidence that I'll be significantly better at answering the adult ones. Over to you, Chair.
Thanks, Matt. Excellent as always. I've got hands raised at this particular moment. Whilst anybody decides to come in. Oh, and as if by magic, Councillor Ridney.
Yeah, and I support Matt. I was at scrutiny board last night. Yeah, it went through children's scrutiny. It was well accepted, and they were pleased about the change. One of the things they've done is change the actual outcome, which was preventing violence across the life course, was actually changed to harm, so that it was much broader. And I think most members welcome that we didn't just see it as just one thing. So yeah, it was welcomed by the board last night.
Chair, I'm unaccustomed to Councillor Ridney asking me questions that are extremely difficult to handle, so you forgive me if I'm slightly disorientated at the moment.
I'm being nice to you, for goodness.
I know.
Get that haircut though.
Yes, you can raise that as a health and wellbeing issue, Councillor Ridney. Thank
you. That's told you, Matt.
Indeed.
No, that's lovely. Thanks very much indeed. And certainly, as you mentioned about everybody, I think, has been hit by some or other scam phone calls or scam email. I'm quite vocal about this. It's using my bonnet that I get, and I do encourage anybody to report them. Through the necessary channels. We've got a fantastic scams team here at Dudley Council. So we need to continue to get those messages out to people and encourage them to report, because the more people that report, the more people that are aware of these going which is what I had for the day. So Matt, thank you both for the report. Moving swiftly on, which is questions from members to the chair, where 2 clear days notice has been given to the monitoring officer as per Council Procedure Rule 11.8.
Chair.
Oh, I'm glad to hear that. Right. Final item on the agenda, and that are the dates for the next municipal year. They are provisional at the moment, but they are certainly worth noting. Of the last in the municipal year, the last meeting of Karen Jackson's. Karen is leaving the council at the end of this month, and has been in the public sector for, I believe, over 30 years or nearly 30 years. Karen, if Karen is still on the call, I can't see. Karen, are you still with us?
I am still with you, yes.
Yes, hiding in the background. Karen, on behalf, it's such a shame that this is not a physical meeting. But on behalf of everybody on the Dudley Health and Wellbeing Board, can I thank you for everything, your input over the years that you've given, not just to this board, but to Public Health, Dudley Council, and also your previous NHS organisations. And I'm sure that is also echoed from all members of the council as well. So Karen, I wish you a very happy and long retirement ahead of you, and enjoy. So Karen, all the very best.
Thank you very much. It's been a pleasure being on the Health and Wellbeing Board's journey over the last few years.
And what a journey it's been. So Karen, all the very best, and thank you again for everything that you've done.
Thank you.
I know that I mentioned earlier that there were 2 other items that we were going to discuss outside of formal business, but I think based on Neil's wonderful presentation, I can put those to one side. But I don't know if members have got any comments that they wish to raise, and obviously that they can do so perhaps via Karen. Are members happy for me to formally close the formal business and also informal business of this board?
Yes.
Wonderful. That's great. Well, thank you very much indeed, and